Welcome to the Dental DA. My name is Nedra, and today we're going to be talking about the most common intraoral imaging errors you need to know for your DANB RHS exam. Now, this is just going to be a quick intro of the most common intraoral errors that you will encounter when taking dental radiographs, but you need to know this for the DANB RHS exam. And I know you guys like it short and sweet, so let's get to it. Now, before we jump right into it, I do want to point out that we do have very affordable options for those of you that are looking for study material resources for the DANB RHS exam. There's a lot of stuff out there, but with that being said, we have curated um, study guides, free study guides, practice exams, and also a review course for those of you that just want that extra attention and that extra help just to ensure that you definitely are going to pass that exam. And if you want more information about that, just check out the link down below and we will get you set up. All right, I know you guys don't like long videos, so let's just get right to it for real this time. So before we go into the positioning errors, I do want to take a brief moment to point out or to discuss the techniques that we're using when we are actually, obviously getting these errors. So I'm not going to go too in detail with these techniques. However, if you do want to know what the techniques actually are, why we use one over the other, um, how to execute these techniques, you definitely want to check out my video on the paralleling technique versus the bisecting technique. And again, these two techniques, paralleling and bisecting, are both techniques that are used intraorally. All right. And the one that we prefer in dentistry that they're going to ask you about on that radiology exam is going to be the paralleling technique. So we do want to do the paralleling technique any opportunity that we can. All right. So when we're talking about positioning errors, we do have to reference the two planes that are involved when we're positioning the PID. And that would be the vertical plane, which is going to be your midline. Think of the midline, that's vertical. And then the horizontal plane, which is going to be perpendicular to that, or is going to be, think of the horizon, the transverse plane. That's the plane going across, going, left to right. So again, vertical up and down, horizontal left to right. The vertical angulation errors that you will encounter when you are executing or you're acquiring intraoral radiograph. So you're basically taking an intraoral image and you find yourself where you did not properly line up your PID vertically, the up and down, the right way with the sensor. Okay, you are either going to have teeth that are going to look too short or teeth that are going to look too long. The teeth that look too short are going to be foreshortened. The teeth that look too long are going to be elongated. So again, depending on your angulation, if you over angulated or under angulated, meaning that you didn't move your PID up or down far enough, or you moved it too far up or down, is going to result in one of these two. So when it comes down to foreshortening, that's going to be the one at the top where the teeth are short and stubby. That's going to be a result of you over angulating. So you angled it too much. So again, if you're on the maxillary arch, which is the upper arch, and you have the PID position either probably too far down, then that's going to be a result of again, that's an overangulation, and that's going to result in a foreshortened tooth. Now, if you're on the mandibular and you have the PID pointed too far up, again, that's going to be a result of a tooth that is going to still be foreshortened, but is going to be on the mandible. And so again, just remember, over angling the PID where you're cutting it too far up or too far down, depending on which arch you're in, is going to result in a short tooth. If the tooth comes out long, which is going to be the bottom image, elongation, that's going to be a result of you not angling it enough. So again, if you're on the maxillary arch and you're taking PA of one of the teeth on the maxillary, then your PID will probably look like it's just dead on, like it's parallel or right lined up perfectly with the cheek. Again, if it's not angled, pointed down or up enough, in this case, pointed down enough, then it's going to make the teeth look really long. Now, again, on the bottom, it'll be the same situation. If you don't point the PID up enough, then that's going to result in the teeth looking really long. So the arch will determine what position, too much or too less. The too much or too less will determine if it's going to come out too long or too short. So we are talking about vertical angulation up and down, and the teeth are going to either come out too short, foreshortened, which will be over angling, like a steep angle, or the teeth will come out too long, which will mean that it's not steep enough. Going right into our next angulation error, positioning error, is going to be our horizontal, which is our left and our right. Now, this is a little bit, I kind of cheated a little bit on this. Cone cut is not quite horizontal, and I'll share a little bit more about that when I get to that. So let's go ahead with the true horizontal angulation error, which is overlapping. Overlapping is just basically when the teeth are imposed on each other. Depending on which direction the radiation is pointed or coming at the tooth um, towards the sensor, they'll transfer over into each other and overlap. And so that's what gives it that cloudy look in between the teeth. Now, that's a problem for us because if we're trying to see between the teeth, we won't be able to see that opening because the tooth, either before it or after the tooth that we're looking at or the area we're looking at, is going to be overlapped. So, again, depending on if you have the PID pointed too far towards the nose or too far towards the ear, will result in the teeth being overlapped. Cone cut is a little different. Cone cut, you can either have the PID pointed too far to the left, too far to the right, or you can have the whole arm too far up, too far down. The whole thing with cone cut is if the sensor is not directly in the center of the PID circle, it's going to result in cone cut. So that's not really a vertical or horizontal thing. It's actually a little bit of all of it. What causes cone cut is the sensor is not centered in the middle of the PID. How do you avoid overlap? Well, the way you avoid overlap is by making sure that your central ray, which again, I'm getting a little more technical than I want to in this video, but if you was to imagine the PID, and then in the very center of the PID circle is an imaginary X-ray that is coming right out that center. We call that the central ray, and that central ray needs to be going in between the teeth. And as and you might say, well, how the heck am I supposed to know that? Okay, that's what they told. That's what they teaching. All right, so but that central ray needs to go between the teeth, and if it's not angled properly between or interproximally, between means interproximal, then it's going to result. So that's just an overview of just a few of the errors that you will encounter when taking a dental radiograph and what will be covered on the DANB RHS exam. There are other errors that you will encounter as well, as far as overexposure, underexposure. You also have things such as penumbra, magnification, distortion, things like that. And you need to know what those look like as well on a dental radiograph. But the most common errors that you're going to run into will be the ones that was discussed in this video. If there's anything else that you guys want information on or you want me to review to help you prepare for the DANB exam, drop it down in the comments section. I am looking for things to cover that will put you in the best possible position so you actually pass this exam. This is a series that I'm doing to kind of cover different sections of the DANB RHS exam. Now, this is not comprehensive, meaning that I'm not giving you all the secret sauce, but I am giving you some of the biggest things that is going to be on that exam. I take the exam every year, so I know what's on the exam so I can be better prepared to provide that information to my students. Thank you so much for joining and viewing. And if you like this video, please hit the like button. If you want to see more material about all things dental, hit the subscribe button. And again, if you have any suggestions, drop them down in the comment section and let me know when are you taking the exam. And when you do take the exam, drop back in and let us know how you did and what your course of action was in preparing for your study journey. Thanks so much. Ciao.
What?